Okay. And as far as lessons learned goes, do you think the cruise lines are postured for the next pandemic?
Given the experience that, we've had with this pandemic, I think there are a number of lessons learned that put them in a new position to prevent at least the severity of the next pandemic by some of the measures that we've described so far. I mean, the physical changes on the cruise ships in terms of the ventilation systems, of course, would help with the amelioration of, respiratory outbreaks, not only from SARS-CoV-2, but any other respiratory diseases, such as influenza, that pandemic influenza that might occur in the future. Also, I think some of the strategies and protocols for managing large numbers of people in the cruise ship environment, there have been plenty of lessons learned there that are instrumental in minimizing transmission of not only respiratory diseases, but gastrointestinal diseases and so on. And I'd be interested in knowing, actually, when the cruise ships actually do return to full operations, what the disease experiences would be before and after the implementation of these public health measures. I think we'll see reductions in not just respiratory diseases, but some other communicable diseases as well. Now, once the pandemic threat is realized, what's going to be important is that there's strong leadership at all levels within the cruise industry to have proper public health procedures and protocols in place and to enforce those, particularly in the face of pushback, which will inevitably occur. I mean, we're seeing that now under the current pandemic. One difficulty I see is, as with all outbreaks, is the human behavioral aspects of disease control. So strong public health messaging that is clear and concise will be required, in my opinion. But they should realize that they will not be able to convince everyone of the need for the operational changes. And so they just need to be aware of that. My last thought is that the cruise industry should not focus attention on a single communicable disease, but by using risk assessment techniques, develop strategies to address any communicable disease, past, present, or future. And I think the lessons learned from this pandemic, brings that to light. So I think they are in a better position for future pandemics. Yes.
Well, George, you've gone through great detail on the origins of the framework for sailing and all the factors that are involved for both passengers and the cruise line industry itself operationally. I'm sure there'll be quite a bit of training that the cruise lines will require to implement all these changes. Is there anything else you'd like to add to the discussion?
Well, I think that the cruise industry should be commended for their efforts in improving the public health standards on board the ship. I think they always are in a position to do that and are always striving to do that because it's mutually beneficial. Of course, it's beneficial to their business as well. But I do think that they've done a really good job in identifying the risks and putting in the necessary steps and interventions to reduce the risk of communicable diseases and to improve public health on board the ships.
Well, George, thank you very much for taking the time to help us understand all this today. And we hope to talk to you again soon.